the gut barrier function, gosh, when you start thinking about the importance of everything that happens from diet, and then when you start thinking about the importance of fiber, probiotics, prebiotics, there's so many things to think about. But the biggest takeaway, if you remember, diets rule. And let's just think about that for a minute. Let's think about the fact that we have so much control over how we feel on a daily basis based on this type of education. You know, I can go for hours and hours in conversations and talking about ways to improve one another. But just talking about this combination and understanding not only the advantages of our fiber powder and the digestive enzymes, but when you overlay the ultimate aloe, when you start thinking about bromelain, not only part of this whole inflammation standpoint, but think about how those unhealthy cells, I don't know if you picked that up, where there's proteins that are an overlay to the unhealthy cells, and that the bromelain that comes in actually breaks down the protease in there, breaks down that outer layer so that your body can get to those unhealthy cells. My goodness, there is so much to learn. Well, the one thing I will say going through each of these presentations, whether it be from Mark Lang and working about the DNA products, and I've got to tell you, those DNA products are making the difference with my grandchildren. And you know what? I like to sneak those DNA chews myself, those DNC combinations with the OPC3. But we have a great presentation coming up with Dr. Deedra Mason. She's going to talk more about inflammation. She's going to talk more about how those affect each and every one of us. So please help me welcome back to the stage, Dr. Deedra Mason.
Hello, everyone, and welcome back. I am overjoyed to spend the afternoon with you talking about something that is so important. And it is, in fact, the balance of inflammation in our bodies. It gets kind of a bad rap because we always think of it as being the root of disease. So I want to talk a little bit more about it. Let's do a deep dive. Inflammation is one of these very unique aspects of chronic disease. It's both a sign and a symptom, which means I can see it as a physician and you can feel it as a patient. And yet it is still so ill-defined by people. You know what I'm talking about. You'll hear someone say, oh, I just have a little bit of inflammation. Or they'll say something like, oh, I just feel a little bit bloated. Oh, I just feel a little bit foggy, right? Well, that's like saying, I just have a wee bit of heart disease. Oh, you know, it's just a small case of diabetes, right? We really need to define inflammation better. And maybe more importantly, we need to define what's going to make a difference in our lives to support a healthy inflammatory environment. We definitely want to make sure when we're talking about inflammation, whether it's a talk of theory like I'm doing today, or we're talking about an actual product, that we stay in line with the FDA, that we do not make claims about treating, curing, or mitigating a disease. But we do want to talk about the staggering statistics. 85% of healthcare dollars today are spent on chronic disease. And we often make the mistake of shaming people into saying that the disease is their fault. When environment, your external environment, not just the internal environment, plays a really big role in how inflamed we'll be or what progresses chronic disease. But we do want to pay attention to these staggering numbers. Between 2000 and 2030, we're going to see an incredible incline in the number of diagnoses of chronic disease. We're going to start to see not just their symptoms and their signs add up, but the way they have to spend their healthcare dollars if they don't pay attention to some of the critical factors that are the root of inflammation, like diet, stress, physical movement, the importance of supplementation, the importance of select nutrients. But probably the most alarming statistic we see when we look at the numbers around inflammation is how many children are affected. Nearly 30% of children, that's anyone under the age of 19, can be listed with one chronic disease factor. It's staggering to find out that some children, 6% of them have more than one chronic risk factor, and it's usually in the line of heart disease or type 2 diabetes. It's wild as a physician to think that today we call it type 2 diabetes instead of late stage onset or an age-related onset diabetes. Why? Because a disease that used to be preserved for the 6th, 7th, or 8th decade of life, we now see in elementary school children. And inflammation is the root. So I want to talk about how do we uncover the root and do something about it. Probably no surprise, but it starts with diet and it starts with lifestyle. Let's define inflammation. It's simply a local response of the body to an injury, to an insult. Sometimes that's a chemical insult. Sometimes it's a cold or temperature insult. Ultimately, the body is just trying to defend itself. So it's also a reaction, and that is a healthy reaction. What I want us to understand is when inflammation goes on too long, we start to see tissue decay or compromise. Now, the reason why I say it's ill-defined is because a lot of people simply wait for things to get out of hand before they pay attention to the signs of inflammation. They wait for pain, which is not just a trigger or a sign, it's an alarm bell. We really need to pay attention before we start seeing pain, joint discomfort, or infirmity, because most people don't recognize that you don't have to get to that point to notice the signs of inflammation. Many people don't recognize that it may be issues with their hormones, issues with their bowels or their intestines, cardiovascular decline, cognitive decline, immune dysfunction, or even skin disruption. These are all signs of low subgrade inflammation. And they are telling you that you need to do something about your body's immune system and your body's inflammatory mechanisms. And the clear target, the common thread, is your diet and your lifestyle. These are the 5 rubrics of inflammation. There's heat like fever. There's redness. There's growth or inflammation. Think of swelling. There's pain from heat. And then there's infirmity. There's physical impairment. And we often see the trend move through these rubrics. And I want you to pay attention at the first sign of inflammation. I also want you to know that whether it's due to an infective agent, something that has compromised your immune system, or maybe it's been going on for a while, and you're somewhat immune compromised to begin with. Maybe that's due to pharmaceuticals, that's due to age, that's due to a long-standing issue, or maybe it's something else going on in your immediate environment. Your body's natural constitution, your body's natural physical and metabolic fitness will play a large role in how well you respond and how well you are able to restore from such an injury. So we want to pay attention to the types of inflammation. And in particular, I want to pay attention to the third type I'm showing here. Now, there's the common that we often think about. There's acute inflammation. That's a short onset and usually pretty quick to resolve. Then there's chronic inflammation. And this is what most people think about when they say, oh, I've got, the weather must be changing because I can feel it in my joints. And that's the sense of a chronic decline or a chronic infirmity. But what I want you to think about is the third type that most people don't recognize, and that is a chronic and active inflammation. This is for the individual that says, I've never felt better since. This is the individual that says, I can't do that anymore. This is the individual that says, I guess I'm just too old, right? They've pretty much thrown in the towel. And the reason they've thrown in the towel is that they do not feel well due to a subthreshold, but constant, persistent inflammation throughout their body. What we're looking for is to help with diet, lifestyle, including sleep, and you'll be surprised to hear this, exercise, we're looking to bring the body to a resolution. We're looking to take what is a chronic, active, but sub-threshold, although it persistent, inflammation, and start to bring it into a phase that we're able to modulate, control. What I want you guys to do as we talk about inflammation this afternoon is think, what is within my control? If the environment outside of me is outside of my control, if pollution and chemicals that have found their way into my air are outside of my control, what is within my control? So I can stop the progression of disease. So I can stop the progression of inflammation that may be wreaking havoc on my immune system, on my joints, on my vascular system, on my endocrine system, and my cognitive functioning as I age. Here's the thing. Inflammation isn't all bad. When we think of inflammation, think of the acute inflammation, right? The ability to protect yourself from injury, to resolve that injury. This whole idea is to bring all those white blood cells to the area, all those rubor or redness and inflammation factors to the area, let's say to stabilize a joint. That's an appropriate immune response. It's when it's prolonged and persistent that it starts to cause harm. What I often say to individuals, the ability to mount an inflammatory response is absolutely necessary for survival. But your ability to turn it off is just as necessary for your survival. And the common thread is your diet. When we think about how medicines work today, right, they often shut down inflammation. We often think about using a chemical agent to shut down insult, but that happens very deep in the tissue. What if we, through diet, could prevent the inflammatory cascade from ever starting at all? What if through supplementation, we could stop that inflammatory cascade from ever getting out of control? What if through physical fitness and a healthy lifestyle, we could stop the inflammation train from getting out of control, never needing any of those chemical or pharmaceutical agents? It's also important to ask, why am I seeing so many people with inflammation? Whether it's dysbiosis in their gut, whether we start to see an immune response that's inappropriate, hyperactive. And I often come down to these answers. Well, I think we're just getting better at understanding what our triggers are. Or I may say, no, that's not it. We've just done better testing now. We're just better diagnosticians. We just know a whole lot more about the body, right? And then I think, well, maybe it's just that there's more pollution in our bodies, more pollution in our food. There's more endocrine disruptors or immune disruptors in the environment. At the end of the day, you guys, lifestyle and diet are the greatest insult to your immune system, are the greatest insult to your inflammatory mechanism or your ability to stop that inflammatory train. So I want everybody to take a personal inventory. Or if you're working and coaching people, I want you to ask them to take a personal inventory. How often do you find yourself in a toxic environment? Whether we're talking about an external environment or the environment we say to ourselves. Think about the words we sometimes use when we talk to ourselves. We want to think about pollution and what does that environment look like? When we think about this personal inventory, what does your environment look like? What does your diet look like? What do your sleep habits look like? And then we want to think about, is there anything that we're doing that's producing more toxicity in the body, right? And this is where it comes down to a food journal, a sleep journal, but really understanding, what do I need to prioritize? When we think about capturing that train, I want you to think about the one thing that you can do today that can support a healthy inflammatory response and a healthy immune response. Part of this comes to understanding the critical balance, not just of inflammation, but also the critical balance of reactive oxidative species. This is oxidative stress. And I had mentioned earlier that it's absolutely necessary to create free radicals to promote healthy metabolism. But just like inflammation, we need to capture those so that they, like a dominoes, don't get away from us, so that we can keep a healthy metabolic environment where we're building up and breaking down, building up and breaking down. So reactive oxidative species are allowing you to create a healthy metabolism, but we need to keep them at a low level. You guessed it, it's your diet that gets them out of control. It's often a lack of